All right, so several examples of departments that just did or are about to shift to the 24/72 schedule, the schedule that for over 7 years now I have been trying to push to become the industry standard in the fire service. 24/72 is a 42-hour work week. So right at the work week that most civilians work, that sleep in their own beds every night and do not have to get up and suddenly run into a burning building or extricate a child from a car. So not really a huge ask in my opinion. However, I really wanted to kind of hit some of the bullet points of why and how they were able to make this work, and also dispel some of the myths. Just to preface that, I have done an interview with the chief of Boynton Beach, Hugh Bruder, which is episode 854. He lays out beautifully how they went from initially 24/48 to where they are now. I interviewed Dixon Phillips, one of the union leadership from Pasco County, and he talks about how they got it to where they are now, and they're projecting they are going to 24/72 the beginning of 2026, or maybe even a little bit earlier. And then I'm about to interview Chief Don Campbell from Gainesville Fire, again, how they got through. And Don, if anyone who recognizes that name, is revered in the world of special operations, the fire school here in Ocala. So another great person to have that perspective from. I would love to say that these all came about because of the burning servant's heart from the people in the chief's office and the cities and the council members. But the reality is it was money that pushed it. So just remember that. There was a huge financial savings that pushed this initiative to happen in these fire departments. So I'm going to kind of walk you through each of these bullet points. Of course, you can expand on the episodes that I talked about. Full resource for you, the Behind the Shield podcast, free. Nothing is, VIP access or anything. And over and above that, I have sleep deprivation experts and, experts on everything on the show. So you can dive deeper and deeper and deeper into these rabbit holes. Let's talk money first, though. How are we supposed to afford another shift? Firstly, if you look at it, Kelly days, for example, are extremely hard to cover, and they involve overtime to cover these vacant spaces. So there's that element. You also have the fact that, for example, the department I work for that had a 24/48, no Kelly, you had more vacation days because of the horrendous schedule, basically. So of course, there would be a negotiation of some of those. The firefighters would still end up with a lot more time off. So you're never looking at a full shift. It's always a kind of percentage of a shift. I think 2/3 was the number I heard in my last department. So firstly, that you're not looking for an entire shift. Then let's look at the term false economy, something I learned in economics in community college, the only thing I remember. You go into the dollar store, you buy a cheap plastic toy for your kid. It cost you $1, but a week later it's broken. False economy. That's exactly how we are running the fire service. And it drives me crazy. I've used this analogy before. Some people refer to the fire service as a business. I disagree. It's not a business. It's a service. That's it. We're not supposed to make money. We're not supposed to justify ourselves. We are there when people are having their worst day. However, if we were going to model ourselves in the business world, right now we're modeling on Indonesian sweatshop. We need to look at the Google, Virgin, these great progressive corporations. And if you look at them, they have cafeterias in their buildings serving clean food. They have gyms in their buildings. Their work weeks have actually got less, and they found equal or more productivity, a lot more progressive. We're on the other end of the spectrum. So if we're talking about finances, if you look on the back end of a city or a county, the way they're bleeding money through their fire service, you have got the workman's comp claims, because we get sick. We have mental health problems. We have physical health problems. So you've got workman's comp, you've got line of duty death payments, you've got medical retirements, insurance premiums, because obviously the sicker we are, the more it costs them and us. You've got the overtime, filling all these holes of all these people that are off sick and now, understaffing. And then you've got lawsuits. When we make mistakes, when we hit someone at an intersection because we're so sleep deprived, when we push the wrong med, that costs millions of dollars. So we are bleeding money on the back end. The problem is, and I've seen this through my whole career, is you have a lot of people that want to justify themselves in a budget year. Now you have to be more, proactive than that. You have to, as they say, plant the seed of a tree under the shade you'll never know. You have to do something for the future generations. So what about recruitment and retention? Well, how are we supposed to hire? We can't even hire now. Same thing. What's happening in 2024 is a young recruit is going online and seeing exactly how the fire service is. When I got hired in 2003, 2004, there was barely any internet, and it was all greatest job in the world, and it is. But none of the dark side was there. The cancers, the suicides, the marital problems, you just couldn't find it online. You found the book of golden nuggets, how to pass your fire test, etc., etc. So these young people are seeing now what we actually do, and they're going, that doesn't sound great. To be told at 7:30 that you can't go home to your children and you've got to stay another 24 hours. I think I'm going to go work for UPS instead. So we have created this nightmare, and then the other thing is financially, we are training these young people. And in Marion County, it's $18,000 per recruit. And a lot of these departments are revolving door departments. And then a year later, they're gone. So think about that, almost $20,000 per person that you're hiring that then walks out the back door. So the mandatories, the lower standards as well, 18 and a heartbeat is dissuading a lot of the really, passionate firefighters because they want to be challenged. You want to be in a good department where they're proud to wear the patch. And then FRS payments. In Florida, from what I understand, every recruit, you have to pay a full year of FRS, the employer does. So there's even that. The acute sleep deprivation, our performance, our mood, our ability to not hit someone in the intersection, our ability to do the right, cardiac algorithm is all related to our sleep. The more rest and recovery we have, the higher the delivery of service. Chronic disease. So you've got everything from addiction and suicide through to obesity, the testosterone disruption that we're seeing, cancers, they are all related to sleep deprivation. Not solely, but sleep is the absolute pillar. And numerous people in the health world have said, if you're not sleeping, you almost don't need to worry about your nutrition and exercise because it's almost a moot point. Sleep is everything. So all we are asking is to give these responders enough rest and recovery between shifts. 24, I think, is essential in the fire service. So let's give them the rest and recovery in between. Another myth, we're going to lose money if we go to a lesser work week. Well, no, it's the same as going to days. Your hourly rate basically increases, your salary stays the same. So, and where does the money come from? All the money that you are wasting in the back end. So, by the way, just touching on that, you will save your department, as you will hear in these interviews, money hand over fist by being proactive, investing in your people's health. You save a huge amount of money. Now you can start putting that extra person back on the rig. Now you can open that fire station that you browned out. So it's a win-win-win. The other thing that I think is the big takeaway, these departments are starting to do this. And if you're a department that's pushing against it, basically because of cowardice, because if it saves money and it helps your people, all that's left is for you to actually show up and advocate for your people and advocate for your city or county. So it's either cowardice or courage. It's simple as that. But also, if you don't, and the departments around you are switching, you're not going to be able to recruit anyone. And you will be the person who is the reason that your city or county doesn't have a fire department anymore. And that's not scaremongering. That's just simple, basic math as well. So the one more thing I want to leave you, because I want to keep this at a certain length. The departments that have announced that they are going to 24/72 have seen a huge increase in recruitment because that is how we get these people lining up. I tested for California against 1,000 certified firefighter EMTs or paramedics, 1,000 for 30 jobs. So that is the fire service of old, and we can get back there again, but we didn't move with the times, and now we've got to shift. Give the work week that supports the amount of calls that we run on. We will positively impact the mental health crisis, the physical health crisis, and we will have an incredibly high delivery of service and camaraderie in our department. If we don't, insanity is doing the same thing and expecting different results. So simply put, this is about you, the leaders. Are you going to have the courage? Or are you going to be a coward and just lean into doing absolutely nothing? That's it.